Guys, welcome to Dentistry. Hope you are doing good. I am Dr. Ayshwarya with you for easy learning and better understanding. If you haven't subscribed to my channel yet, please go and subscribe to my channel and learn the dentistry in an easy manner. Periodontal pocket. I have given you the classification in my previous video. Now today we will be starting with the periodontal pocket in detail. What is periodontal pocket? Periodontal pocket is a deepening of gingival sulcus. When there is a deepening of gingival sulcus, this is the intact gingiva and this one is the detached gingiva. Okay. So when the sulcus leaves the surface of the tooth and it makes a gap here in between, the gap is present, that is known as the deepening of the gingival sulcus. What are the clinical features of periodontal pocket? Signs and symptoms today we are going to see. First, we are going to see the signs and symptoms. The sign of periodontal pocket is there will be a puffy gingiva. The puffy means the swollen gingiva will be there, shiny, discolored with exposed tooth surface. The shiny gingiva with discoloration and the tooth will be exposed. Enlarged bluish red marginal gingiva with a rolled edge. The rolling of the edge will be seen on the sulcus region that is separated from the tooth surface. As I have told you, the sulcus will be detached from the tooth surface. This is known as the periodontal pocket. This forms the periodontal pocket, the space between the sulcus and the tooth. There will be a gingival bleeding present. Purulent exudates. Purulent exudates means there will be a presence of some kind of liquid between the gingiva that forms a sulcus and the tooth. There will be a presence of some exudates, some liquid type material. Due to the periodontal pocket present, there will be a diastema because diastema will be occurring due to the mobility, migration and extrusion of the tooth. When there is a severe kind of periodontal pocket that is chronic, it has become chronic, there will be a mobility and migration seen and also with the extrudation, and this causes the mobility causes the diastema. So this is the clinical signs you can see in the periodontal pocket. The symptoms is the itching in gums. What the patient will going to tell you. These are the symptoms and the signs are those which you can see with your naked eyes. Symptoms, these things will be told by the patient. Itching in gums. Itching will be there in the gums. The tooth will be sensitive to heat as well as the cold one. Radiating pain. The pain will be radiating. Localized pain also presents in the periodontal pocket. There will be a foul taste present. Okay. So this is the clinical symptoms of periodontal pocket. Further, we are going to learn about the pathogenesis of the periodontal pocket. First, you have to learn that this is the oral epithelium. Okay. And this is the junctional epithelium of the tooth. This part is enamel and this the inside part, this is the dentine. Okay. Now, pocket formation starts from where it starts. It starts from the gram positive. I have to use the different pen. It starts from the gram positive bacteria over what supragingival tooth. Here, this is the supragingival tooth region. Here what happens? The gram positive bacteria, they layer themselves on this region. This is the supragingival tooth surface, and the extension will going to takes place in the gingival sulcus. This bacteria will go inside and it reaches the gingival sulcus region. This is the gingival sulcus region. When the bacteria is present on the tooth surface, here they are present on the supragingival and it reaches down on the sulcus region. At that time, the periodontal pocket forms. These pockets are formed by the microorganisms. This pocket formation is due to the microorganisms as well as their product formation. The microorganism which produces the toxic substances or the products that causes the deepening of the this sulcus and causes the periodontal pocket. Okay. This product will cause the pathogenic reaction inside the sulcus or the periodontal pocket. It will going to create a reacting agent and this will leads to the occurrence of the gingiva sulcus, that is deepening will be taking place in the sulcus region and that causes the periodontal pocket. When the bacteria reaches the sulcus region, after that the junctional epithelium it starts proliferating. The proliferation will going to be start in the junctional region. Along the root, the finger-like projection will going to be formed. As you can see, this is the finger-like projections are formed at the junctional region. These finger-like projection will be formed during the time of the proliferation. Here the coronal portion, this is the coronal portion, this part is the coronal portion, gets detached from the tooth region. It will going to detach from the tooth region. It will form like this, okay, like this. The detachment will be present or the detachment will be seen in this region. Why the detachment takes place? There are many types of detachment causing agents. That is, first one is enzymes. Enzyme produced by the bacteria. Enzyme produced by the bacteria. Okay. They causes the reaction or chemical reaction at this region and they go inside and deepen the sulcus. This causes the detachment of the sulcus or this oral epithelium from the tooth. Also with the when the bacteria grow rapidly, okay, it will grow rapidly. At that time also the detachment of the oral epithelium takes place. After the growth of the bacteria, as you know that neutrophils, these neutrophils, what they do, they engulf the bacteria and they kill them. And these neutrophils causes the inflammation at the region where they kill these bacteria. This you know. So when the bacteria has come deep into the subgingival region, this is the supragingival and this is the subgingival. It has reached to the this part below the gingiva and the bacteria has come down at the or bacteria or plague has come down deep. At that time what happens, they are going to increase the migrating neutrophils. The neutrophils here will going to migrate. These are the neutrophils. They are going to migrate inside this junctional epithelial region. What they are going to do? They are going to increase the concentration of chemotactic factor. Okay, this factor will going to be increased and the inflammation will going to be takes place at this region. Okay, the concentration of chemotactic means chemical reactions will going to be seen. They are going to engulf these bacteria. They are going to try to kill these bacteria, and this will lead to the inflammation. This inflammation at this region, and because of the entrance of the neutrophils, the vascularity will going to be seen. The substance leads to the vascularity. Now the neutrophils has entered inside, still they have not arranged themselves or they have not accumulated themselves in the junctional epithelium region. But this pocket epithelium, and this will going to form a thick layer, the subgingival plaque of the surface of this region. Subgingival plaque, this bacteria has come to the deepened layer, and this has become the subgingival plaque area. Now this layer has become thickened. At this region, the neutrophils are visible partially, but they are performing their function completely at this stage. Okay, they are partly visible, they are very few at this moment. They have not accumulated themselves in the junctional epithelium, but they are few. They have made a vascularity, but they are not they are few, but they have complete function. They are showing the complete function, that is engulfing the bacteria. Normally what happens at this region, that normally happens that neutrophil going to engulf these bacteria. They are going to kill all the bacteria. But here what happens, the bacteria has increases themselves so much that they are releasing now lipopolysaccharide and leukotoxic agents. They have made such a toxicity that these neutrophil action is, they destruct the action of these neutrophils. They don't allow the neutrophils to kill themselves, and they win. Okay, these bacteria wins and they make the neutrophils to lose. Okay, that's why now further the pocket formation is taking place. Bacteria are growing more and more, and neutrophils are inhibited by these bacteria. As these bacteria are growing more and more, the pocket formation is growing more and more. These junctional epithelial region is becoming ulcerated. Inflammation has reached to the level, okay, higher level, and these bacteria has come more down and down. They are doing the deepening, more deepening. At last what happens, the bone here will resorb. Okay, now the neutrophil has arranged themselves in this region. Okay, at this stage now the neutrophils has arranged in this junctional epithelial region, but still they can't do anything, these neutrophils, because this bacteria level is so much high that these neutrophils are not able to make them defeat. As the destructions are proceeding more and more, it will going to lead the resorption of the bone. This bone will going to be resorbed slowly and slowly, because these bacteria will going to come inside. They are going to come inside, okay, and they are going to resorb the bone, and the pocket formation will going to be more deep. This pocket will going to more become deep like this. When you are going to check with your probe will go in this sulcus region more than 5 mm at that time, and even you will see the inflammation part here. redness, swelling of the gingiva. The pocket will be more than 5 mm, about 7. So that time the periodontal pocket has formed, and if you are going to take the OPG or IOPR, at that time there will be a bone loss seen at that region. So this is the pathogenesis of the periodontal pocket, from the supragingival bacteria up to the bacteria forming themselves. They are proliferating themselves in the subgingival region, and they are doing all the destruction at these regions. Histopathology of the periodontal pockets are: first, in the initial stage you are going to see that gingivitis is taking place, but once the pocket is formed, further you are going to see the changes in the soft tissue. When you are going to see the soft tissue, sorry, my pen is not working. When you are going to see the soft tissue, what changes you are going to see? The blood vessels will be elongated and dilated. As I have told you, neutrophils has entered inside this junctional epithelium. They are trying to kill the bacteria, so they have dilated and elongated the blood vessels. Connective tissue edema. Edema, you are going to see the redness, you are going to see at this connective tissue region. Infiltration of the plasma cells. These plasma cells will going to come inside this region, as well as the leukocytes also come in this region with the neutrophils. Okay. With the neutrophils, the leukocytes as well as the plasma will going to be seen at this junctional epithelial region. These are the changes when you are going to see the histopathology of this periodontal pocket region, soft tissue. If you are seeing the overall changes, you are going to see overall changes. What you are going to see? The epithelium of the pocket is proliferated. The epithelium present here, they are proliferated, and degenerative changes will be seen. This degeneration will be seen. The formation of the epithelium will be degenerated because of the inflammation, as I have told you, edema. Okay. The projections. This projection will be deep in the connective tissue. First, these projection were very slight projection was there. When it comes to the pocket, this projection will going to form a finger like shape, and they will be a deep in the connective tissue. Infiltration will be seen of the leukocytes and inflammatory cells. I have told you. Degeneration and necrosis will be seen at the epithelium region. As the bacteria are coming, they are destructing the surface. Because of that only the pocket is formation, right? So they are going to destruct, they are going to necrose the tissue. These are the histopathology of the soft tissue, as well as overall changes seen in the periodontal pocket. What contents? Now we are going with what contents you are going to see in this periodontal pocket formation. You are going to see the microorganisms in debris. If you are watching the debris, there you are going to see the microorganisms. This is the main part. Okay. And also their products. As I have told you, microorganisms, they are producing their products, their toxic products, that you are going to see in products: enzymes, endotoxins, and metabolites. Okay. Dental plaque you are seeing. First, dental plaque was only forming, no? So dental plaque, gingival fluid you are going to see. These things you are going to find in the sulcus region as well as the pocket. Food remnant. In the pocket, these things you are going to find. Food remnant. Whatever the patient is eating, that thing will going to accumulate in the pocket. That those things we are that will going to accumulate in the pocket. Saliva as well as salivary mucin. Okay. Desquamative desquamated epithelial cells in this will be seen, and leukocytes, neutrophils, inflammatory, all the inflammatory cells. In purulent excretes, there you are going, these are the debris. Okay, these are the debris part. When you are going to see the purulence, there you will see the necrotic leukocyte. Why necrotic leukocytes? Because bacteria are so much that they are not killed by these leukocytes, so they itself get killed by the bacteria, these. And degenerative changes will be seen. Dead and living bacteria, both you can see in this junctional epithelium while the pocket formation, both living as well as dead bacteria. Bacteria living as well as the dead. Okay. Serum will be seen. Sorry. Okay. These are the content of the periodontal pocket. These things you are going to see when you are going to examine the periodontal pocket. Okay. Treatment of the periodontal pocket will be seen according to the true and pseudo, suprabony, infrabony, and under the three main headings we are going to see the treatment. First is true and pseudo pocket. In true pocket is that when the pocket is 2 mm, at that time that pocket is true pocket. Pseudo pockets are the when the pocket has reached above the 5 mm. At that time those pockets are known as pseudo pockets. True pockets, there you are going to do the scaling and root planning. Same you are going to do the first treatment, pseudo pocket, scaling and root planning. You are going to re-evaluate the pocket and maintenance. Maintenance will be there, oral hygiene will be maintained, and proper mouthwash and cleaning will be maintained. Same in pseudo pocket you are going to do. Pocket valve removed. In true, pocket valves will be removed, and the removal of the pocket of the tooth side. The tooth side pocket. The tooth which is suffering from the pocket, that you are going to remove. Okay. Removal of the pocket from the tooth side. Here, up to the revolution and maintenance. After this, when the pocket persists, still the pocket is present. After this, you are not going to do anything. You are just going to do the gingivectomy or gingivoplasty. These two things, these two treatment will be done in pseudo pocket when the pocket is persisted. Okay. This was the according to true and pseudo pocket. Now we are going to see the suprabony and infrabony pockets. Treatment according to suprabony and infrabony. In suprabony, you are going to see the anterior and the posterior. For anterior treatment and the posterior treatment, we are going to see. And in infrabony, if there is a new attachment, sorry, in infrabony, the new attachment procedures are seen. Here the infrabony means that the level of the pocket has reached to the infrabony, deep down the bone. So you have to attach a new thing. So new attachment procedures will be added in this. Okay. In suprabony, anterior as well as the posterior. In anterior, you are going to do the scaling, root planning and maintenance. Same thing you are going to do in the posterior one. In anterior, if the pocket is persistent, so that time you are going to do the curettage. In posterior one, if the pocket is persistent with inadequate access, that is, this pocket is not able to reduce, so at that time you are going to do the flap surgery. This is the last treatment of posterior one. In anterior one, you are going to do the curettage. Further, moderate to severe pockets. If the if the pockets are severe, at that time you are going to do last step, flap surgery, utilizing the cervical incision. You are going to give the cervical incision with the flap surgery. So this was the last step in anterior one, and for posterior one, the flap surgery is the last step if the pocket is persistent. In infrabony, new attachment procedures are there. That means if the bone loss has taken place, you are going to add the bone graft in this region and you are going to do the flap surgery. This is the new attachment procedures, because after the bone formation only the gingiva will going to be formed on the upper region. If the bone has lost, and with the bone loss the gingiva will also come down. The gingiva will going to come down at this place. So to make the gingiva uh, again back to the original place, you have to attach here, you have to put a bone graft here. This is also a new technique to put a bone graft, and you have to maintain a bone. After that you are going to do the flap surgery and you are going to attach the flap on the original position and you are going to leave that. After few months the gingiva will going to come at the original place as well as the bone formation will be seen. This is the infrabony treatment. Other three main heading of the treatment are new attachment. First, new attachment techniques. Here what you are going to do, okay, new attachment technique, you are going to place the, you are going to change the gingival position. You are going to reunite the tooth position at the coronal to the base. That means you are going to do the non-graft associated or graft associated techniques will be used, or combined technique will use. The bone graft will be added and the flap will be raised on this coronal part. As I have told you before, these are the new attachment. In the infrabony, you are going to do this. Removal of the pocket. This is done by scaling, root planning, as I have told you. And gingivectomy will be there, or undisplaced flap will be treatment will be taking place at this region. Okay, at the removal of the pocket. And the last step is tooth extraction. When you are not able to do the treatment, if the treatment you think that it is not possible, at that time the tooth will be extracted, or the partial if the single wall or two walls are involved on the same side of the tooth. If this is the tooth, okay, from the occlusal region, if the single side is that pocket formation is there, if the single side, the hemisection will be done, or partial extraction, that is partial extraction will be done. This partial extraction will be done when the root is resolved or root recession is taking place. This will going to remove the pocket with the tooth. Full extraction or partial extraction. These are the three other headings for the treatment. The simple, that means the different heading, not with the true or pseudo, not under the true and pseudo and supra and infra. Leaving that, these are the three headings. You can subdivide and do the treatment. Okay, this was the periodontal pocket session. If you are understanding this video, please like, subscribe and hit the bell icon for the latest upcoming videos. Share this video to your friends and your batchmates for easy learning and better understanding. Follow me on my social media accounts. The links are given in description box. If you understood the video well, please like, subscribe and hit the bell icon if you haven't done before. my channel. Keep watching Pen Dentistry. Share this to your friends and your batchmates for easy learning and better understanding. Thank you.